Good afternoon, everybody. I think after the first good talk, everybody is wide awake. So let's start with the second talk. The second talk is going to be given by Dr. Judith Wong, our another international partner from Singapore. So we thank the Singapore team to continue to participate in our conference. Dr. Wong is from Environmental Health Institute. She is also a director at the Environmental Health Institute, National Environmental Agency of Singapore, where she is overseeing microbiology and molecular epidemiology division. She also leads a multidisciplinary scientific team related to One Health program that is very popular nowadays internationally. She was integral in setting up Singapore's wastewater-based epidemiology program. That is another hot topic after the pandemic. And this program got expanded from a research initiative to a countrywide wastewater monitoring network. She is also involved in the development of various environmental mitigation and technical advisories for COVID-19 and other dangerous pathogens. And currently she serves as Deputy Lead for Environmental Transmission and Mitigation Co-op for the Program for Research in Epidemic Preparedness and Response. And the acronym is very interesting, PREPARE, under Singapore's Ministry of Health. We welcome Dr. Wong to give her presentation. Thank you.
Thanks, Sanjay, for the introduction, and thank you very much for having us here today from Singapore. So we flew over half the globe to come, and we're really glad to meet with everyone, like-minded people working on environmental health and environmental threats. So I'm from Singapore and from the National Environment Agency. I will share a little about our agency before I talk about the presentation proper. So really what we are sharing about is really our experience on environmental risk assessment and mitigation of COVID-19 and other pathogens. So when we think about it, we're really looking at pandemic threats, but when we're also talking about biothreats, many of these would be actually in the same nexus. But first on our agency. So our agency really covers quite a broad scope. I believe a lot is quite similar to EPA. So we look at public health standards. We also look at really sustainable and energy efficiency, as well as climate services, among others. And of course, today we will really be focusing on public health standards and the living environment. So in Singapore, we are committed to really living in a city in a garden. So apart from the urban landscapes, we do have quite a number of natural environments really interspersed in our urban space. But what this means to us is really understanding what are some harmful microbes in terms of viruses and bacteria in the environment which could pose a threat to public health. And also another question that we often ask ourselves is, how do we mitigate the risk of exposure? My presentation will focus really on COVID-19 and Mpox, but really a lot of our work extends beyond that, beyond the urban settings, also into some of the natural environments. And we were talking about One Health. So this is really a popular One Health image where we see how the environment is really a role that it's both the receiving end in terms of like from animal agriculture and from humans, we do receive quite a lot of the microbial discharges and waste. But at the same time, the environment could also be a mode of spread. So really, we do need to understand what's happening in the environment. And in our agency, we have deployed different surveillance capabilities to understand threats in both the natural as well as the built environment. Most of these studies were really focused about understanding whether or not, for example, soil, air, fomites are means of transmission. But I also want to mention about wastewater surveillance, which we know now it is really, in a way, we don't use it to understand wastewater as a mode of transmission, but we use it to understand the spread of a disease in the community sampled. So really the environmental matrices give us a lot of information. I believe that the community here knows even more than me, but really we really want to share our experience and also learn from you. So our approach to environmental surveillance is quite similar to some of the studies shared here. We really think about the study design, the sampling, laboratory testing, and mitigation and response. I think a few points that I do want to highlight is really the study design and the study hypotheses, which does motivate how we design some of our studies, which I will introduce later. They do vary quite a bit because of the motivations. Then in terms of sampling, apart from really knowing what to sample, the sample sizes would be important. We've heard quite a bit about sample chain of custody to ensure sample quality. And these are some things that we also consider in our settings. And of course, with regards to microbial threats, then the test algorithm would be important because we need to think about what methodologies allow us to test, for example, the presence or absence of the agent. And then the other part is about the viability. And underpinning all this is the risk assessment in terms of which risk group some of the agents we're testing for and what protocols we need to have in place. So with that, I'll now move on to our COVID-19 experience, where we have used a few different environmental surveillance approaches across the pandemic to really understand and have risk assessment of the situation. So Singapore first had our first case in February 2020, and there were a rise in number of cases, which then led us to implement the circuit breaker sometime in mid-2020. And these were the early days where we didn't know much about the virus. And as a response in our agency, we issued advisories in a proactive way. And really thanks to many of the materials that were from the EPA, in terms of disinfectants, what are efficacious, etc. It does help us to sort of develop some of these guidance as well. And at the same time, we also rolled out some environmental surveillance initiatives to really understand the transmission risk of back then an unknown pathogen. Of course, as we knew more about the virus, another significant event was really when the Delta wave hit. Because back then, when the Delta wave hit, COVID-19 was still thought to be spread mainly by person to person. But when Delta wave hit, we realized that the virus was very transmissible, and then we started wondering whether it was airborne. So we did some of the environmental surveillance studies, which help us to facilitate understanding and to support also the international community in terms of findings that it was increasingly known to be aerosol mediated. So after which the Delta wave continued, and we also had advisories on improving ventilation and indoor air quality. And of course, as we started to sort of ease into endemicity, as more waves, subsequent COVID-19 waves hit, and as the vaccination in our population also reached a good percentage, we then gradually eased some of our safe management measures. And thereafter, we also conducted some of these environmental surveillance initiatives to understand what are the other policies we still want to retain in endemic COVID. And of course, as Singapore exited acute phase of the pandemic, we then also tweaked our advisories accordingly. So with that, I'll share a few specific studies which we have done across the phase of the pandemic to share some examples of how environmental surveillance has helped us to inform policy and some of our guidances. So as I mentioned earlier, this was one study which we done in the early days. Back then, caseload of COVID-19 was very low in Singapore. And we monitored and sampled many of these places where COVID-19 cases visited. We tested, for example, the lift lobbies, we tested the accommodation rooms, and based on the sampling, we realized that there was an overall very low level trace detection of COVID-19. And this was also coupled with an intense environmental cleaning regime. And when we saw that there was an overall low trace detection, it encouraged us in terms of, it allowed us to realize that our cleaning protocols were sufficient. And at the same time, it also helped us to focus where to clean. So in this study, we actually found that the trace detections were found in the case room And really this tells us that the primary cases or the primary areas where the cases resided in would be where we want to focus our cleaning efforts on. So thereafter, as I mentioned, when the Delta wave hit, we had one very interesting case where there was a cluster in a local hospital ward. So this cluster of cases, there were about 40 over cases, and they were distributed in 2 wards. One interesting finding was that some of the cases were not in contact with one another. And so this led us to wonder what was the mode of transmission and how did they come down with the COVID-19. So the classical epidemiology in terms of contact tracing could not fully explain the spread of transmission. And what we did was that we then went down to help the hospital with case investigations. We conduct smoke tests, ventilation assessments, and we also sampled the aircon filters of the various wards. And interestingly, we found that the areas where there were the largest number of cases coincided with the areas where the aircon filters had the highest concentration of COVID traces in terms of RNA. And at the same time, the ventilation of those wards were the poorest. So collectively, using environmental surveillance, we were able to show that there was a likelihood of long-range airborne spread in addition to close contact spread through droplets. So the data formed the body of evidence, which increasingly then, together with the international community, we were able to realize that COVID is increasingly airborne. And of course, as we learned to live with COVID in endemicity, we continued surveillance efforts in various premises types. We did detect traces in the air, in fomites as well as wastewater. Thankfully, none of the samples were positive for virus culture. But what this tells us is that we do need to continue to encourage good ventilation and regular cleaning in our premises. So in addition to, for example, using the data to inform some of our operations, we were also very proactive in terms of our COVID response to engage the community. So we had public campaigns to our premises operators. For example, we had the SG Clean campaign, where we encouraged our operators to really maintain a high level of cleanliness and public hygiene. Additionally, we also have other campaigns to encourage good public hygiene practices among our community. So infographics were very common for us to communicate some of our policy and some of our findings. And also in terms of improving ventilation, we also had these other ones which we sent to premises operators. So these are also some of the guidelines and advisories as we moved out of COVID that we felt were necessary to retain in endemic COVID, and again, driven by some of the data that we have. And I believe similar to EPA, we had many lists before this trimmed down list. We had the equivalent of list N, etc. And right now we believe that this would be something that we want to have moving forward. And as we came out of COVID, we were then faced with another threat. So the global community last year would recall that we had a surge of Mpox cases across the globe. And similarly, Singapore also had a number of cases. And again, the virus was a re-emerging virus, which we then also wondered, what are some of the modes of transmission now that it is, in a way, seemingly re-emerging and it could also be new? So we conducted environmental sampling around an Mpox case. We collaborated with our hospital colleagues or our doctors at the National Center of Infectious Diseases. We deployed different types of samplers. We deployed air samplers. We deployed fomites and dust samplers to understand what is the mode of spread in these cases. We also did wastewater surveillance. So there were a total of 180 samples which we collected across the different phases of illness. And over here, we found, quite expectedly, widespread contamination of surfaces around the patient's room. And this was expected because we knew that Mpox is fomite mediated, in addition to close contact transmission. Interestingly, we also detected Mpox DNA in air samplers. And this then collectively helped us to guide the disinfection as well as the PPE guidance. We detected viable virus from the patient's toilet seat as well as the dust sample. So while traditionally we were told to sort of take care of the dust linens, our findings then allowed us to also focus on other areas such as toilet seats and the seats of patients because of the epidemiology of the cases in the recent wave. And over here, we could see the graphs of the air sampler trends, as well as the fomites and dust trends, and also the positive virus culture. Thankfully, the viral load generally decreased after 7 to 8 days, and this helped us to also inform in terms of the quarantine timelines. So with that, I'll now shift gears to wastewater surveillance, which I mentioned earlier that it may not inform, for example, the mode of transmission, but when we test wastewater samples, we would be able to know the spread of transmission in the community. So we had used wastewater surveillance for COVID-19, as with many other countries. And in our use cases, we were able to detect, for example, one case in a residential block. And this facilitated early warning because the case was, in a way, tested positive even before the onset of symptoms. After that, we were able to do monitoring at a population level to understand the spread and the trend of the disease spread. And as we moved out of COVID, we have also tested wastewater for different threats. And in Singapore, interestingly, we had a cluster of cases of Zika sometime earlier this year in June. We deployed wastewater samplers at the area, and we were able to detect traces of Zika in that area. And thankfully, when we deployed in other areas in Singapore, they were negative. So what this helped us to understand is that there was no further widespread transmission of Zika. And this is especially important for Zika because the virus itself, or rather the Zika infection itself, is typically asymptomatic. So cases will not often present themselves. And in a way, the wastewater surveillance provides a non-intrusive way to monitor the spread of the disease. So apart from Zika, we believe that it can also be used for many other infectious diseases threats. And if we think about it on a bio-threat angle, wastewater surveillance could also provide non-intrusive surveillance. And with that, now I'll shift gears again to some of the other studies that we've done in terms of understanding disinfecting technologies. So again, many of these studies really were done during COVID-19, and those were the motivations. So for example, we studied, the reuse of N95 masks because of global supply chain shortages. So we evaluated a few different methods in disinfection. Thankfully, we were able to show that there was sufficient log reduction for mango virus. And also we tested, we also tested the mycobacterium. Yeah, and we were able to see a good log reduction. And even the fit test was also good. But thankfully, we didn't have to keep reusing it. So although we were worried about supply chain shortages, I think eventually we were able to sort that out. But again, this study actually does help us in terms of future situations. So in terms of evaluations, we also had done a couple of other field evaluations. And one thing I would also like to highlight is that Singapore is actually a very warm country. We have a tropical city. We have summer all year round. So our situation is quite different from like many of the other countries in temperate settings. So some disinfecting technologies may work in other settings, but in Singapore, we do know that we actually do need to evaluate some of this in our context. So for example, for the gaseous ozone surface disinfection of buses, we actually had to optimize in terms of the disinfection cycles. We had to adjust the humidity levels, etc., in order to find the optimal settings for disinfection. Thankfully, we were able to optimize that, and we were able to obtain good log reduction after the disinfection cycles for the murine hepatitis virus, as well as Staph aureus. Unfortunately, however, when we looked at self-disinfecting surface coatings, which were also very popular during the pandemic, and there were different formulations available, when we did some of these tests in lab and field settings, we didn't have results that were as good. Yeah, so we actually chose the EPA method to do the study because we felt that they were more relevant in our settings. So over here on the graph on the left actually shows our laboratory tests, which were quite decent if we look at like the log reduction of the virus. The products 2 and products 3 gave us about 2 to 3 log reductions in laboratory settings. However, when we brought it to the field, this meaning that when we put it in terms of challenge, we allowed people to touch on it, we did wipes on it, we realized that after 2 to 3 months, the efficacy was almost zero. Yeah, so what this showed was that while these self-disinfecting surface coatings were efficacious in laboratory settings, in our field settings, for example, in warm, humid Singapore, where we touch, and then, in terms of durability, they do not last very long. So collectively, the studies actually showed us that we do need to evaluate many of the disinfecting technologies in our local settings. So with that, I would like to end my presentation, really just a summary of some of the work that we've done in Singapore. We've done environmental surveillance to inform risk assessment, response, and mitigation of the biological threats. They did give us clues in terms of understanding disease spread and also to minimize further exposure in terms of guidance on disinfection as well as PPE. We believe that some of these capabilities which we have built up for the pandemic can also be pivoted towards other biothreats. And there would also be a need to do ongoing monitoring. And of course, the other part, which I mentioned earlier, that disinfecting technologies do need to be evaluated in our local setting. So with that, I would like to thank our team members who have worked on various projects, and thank you for your time.